on the IHOPE, which is the Indian Health Outcomes Public Health and Economics Research Center. And we have Dr. R.D. Ravindran as our honorable chair for this session. And we have a list of speakers on different topics. Apart from myself giving a brief introduction about IHOPE, I'm not sure if Dr. Namrata, she would be busy, but the role of AIS in guidelines and advocacy is what she would be talking on. And then Dr. Anthony Vipindas, my colleague at LV Prasad Institute, will be talking on big data in ophthalmology, including EMR. We have a special guest, Dr. Abha Mendirata. She'll be talking on introduction to HT or health technology assessment. She's a pediatrician by training, but she does much more than that. She is part of the Center for Global Development. She is the non-resident fellow in India, and also she did her MPH from Harvard, and also has been a consultant to the World Bank and other important agencies, including working with NICE. Then we also have our very famous secretary of VRSI, Dr. Manisha Agarwal, who will be talking on the efforts of VRSI in diabetic retinopathy, how we are involving the Diabetes Society, the RSSDI. And last but not the least, we have the specialists from ophthalmology in health economics. Will be Dr. Sunny Sengupta will be talking on basics of health economics and health insurance. But I would be starting off with just an introductory uh, presentation on IHOPE, what is IHOPE and what all activities we do. IHOPE is a collaboration between LB Prasad Institute, IIM Ahmedabad, and IIPH Hyderabad, funded by the DBT Welcome India Alliance, which started in April 2020. It was formed with the objectives to develop a knowledge center which will create new knowledge and also disseminate knowledge in clinical and public health research, and attract and train talent in various forms. One is through the long term fellowship program that we have, and also through online learning platforms, which we have more than 900 people enrolled now in developing them as clinical researchers, and also try to influence health policy in India based on new knowledge. So that is research to policy. And the IHOPE Center provides end-to-end support for any study, right from retrospective to prospective, protocol writing, study hypothesis, and all approvals to the data analytics, and also disseminating the information, also working along with the policy makers. Um in terms of the projects, broadly, we are aligned with the overall objectives that the center has been developed for. I'll be listing some of the projects, but apart from the projects, the publications, we also have the IHOPE Journal of Ophthalmology, which is a unique journal focused only on public health, health economics, and guidelines publications. And then, in terms of the capacity building aspect of IHOPE, we have the CRTP program, which I mentioned, which is the long term fellowship program, clinical research training program. We have the online training module. We also have various webinars, monthly webinars, and also the IHOPE conference. In terms of research to policy, we work closely with the NICE of UK, NICE International of UK, and NHA, which runs the Ayushman Bharat program in India. Uh, just to give you an overview of the types of projects which we are handling, some of them are listed here. The biologics and biosimilars competitive dynamics, based on the US Senate passing a law in biosimilars way back in 2010, I think, during President Obama's time. What happened to the dynamics of the biologics industry in India? And we all know biologics India is the leader actually, but that had a big influence on how the Indian market prepared for the US, or the Indian pharma industry prepared for the US market. And also technology diffusion. We have new technologies coming up, One of them is listed here as OCTA, but then we also have looked at other new technologies in ophthalmology, including LASIK and other refractive surgeries, and found out what were the various influencers which affect the overall uptake of these new technologies in terms of patient care. We also have looked at the gender differences in accessing surgical care. What are the differences between male and female in what age group? Just to highlight one point in here is that while most of the care we found males were taking more than females in terms of hospital footfalls or surgeries, but specifically in terms of refractive surgery in the age group of 20 to 30, it was females who were getting more surgeries done. Not just that, they were spending more also per surgery compared to males, and that probably is related to the marriageable age group which we have hypothesized. And also, other than that, we have been working on guidelines along with NHA, AIOS, VRS, and Glaucoma Society. Also, we have formed a secretariat of IHOPE, which the members and the speakers who are here are part of that. The IHOPE journal is issued or published once in 4 months, so 3 issues a year. First edition was in January 2022, and we just released the fifth edition. And as I mentioned, it is not a routine clinical journal. We have been working with NICE on learning how the NICE international or NICE basically guides NHS with different guidelines, treatment guidelines. And so far, we have had 6 knowledge transfer sessions. We're working on the next packages with them, and we have included numerous organizations in these workshops along with NICE, so that most people or most organizations can benefit from these knowledge transfer workshops in India. As I mentioned about the iHope Learning Hub, uh, we have the Learning LMS platform where we have these clinical research, basic and intermediate courses, and also AI, artificial intelligence in health, and diabetic retinopathy grading. Various countries are, or students from various countries have enrolled in this, and it has picked up good pace. At this point of time, it's a self-paced course. Usually within 3 months is what most of the candidates are completing, and at least for the clinical research module, once they complete the basic course, they are eligible to go on to the intermediate course. I know Dr. Sen Gupta here runs a very popular course on clinical research, but overall these modules which we have multiple speakers from different universities, including the London School of Hygiene and also from the Wills Eye Hospital. We have also had 2 annual conferences. The third one is for this year, September 29th and 30th. Again, we divided into four verticals: public health, big data, health economics, and policy. And we have both Indian and foreign speakers in these. This year, we are going to include speakers related to Africa too. In terms of webinars, we have monthly webinars for our different aspects of health guidelines or public health and health economics. And one important area which we are looking at uniquely is patient engagement or public awareness. And they, apart from being involved in the patient engagement webinars, which are different from the webinars for the experts, they are also, patients are also, or lay persons are part of the guideline committees, and also a member of the secretariat. And recently, Dr. Anthony Vipindas actually um, developed this new iHope community website where we will have, it's kind of a LinkedIn for us, where people who are uh, getting in touch with so many different touch points like the LMS, journal, and collaboration of projects can be part of this community, and they can actually post and chat like a LinkedIn community. The NHA Ayushman Bharat team has also had multiple interactions with us. We are looking at the health packages and intervention pricing, provide feedback, and also they have asked I hope to participate in the with us as a group, and also looking at updates to those packages right now. At the end, I would like to play a video. Actually, it's a long video. Develop. Oh, there's an audio and this it doesn't come here. So uh, I'll be so yeah. So this is Hugh McGuire, who is a methodology specialist at NICE, but uh, he gave a message of what NICE does, in terms of not just for NHS, but they also work with other international or other countries and health ministries, helping them develop guidelines. And
sevens and almost best practice. There was a paucity of polystyrene.
yeah, so
Hello, my name is Hugh McGuire and I'm a Senior Scientific Advisor at NICE International. I'd like to thank Dr. Narayanan for the kind invitation to present this video to you today. And I will be talking about how NICE develops guidelines and supports the implementation of these guidelines in the NHS. To start with, I'll take you back to 1999 when NICE was created. And this is the context back then. There was a huge amount of evidence being produced, and there was no guidance for professionals on what to do with this evidence and what was best practice. There was a paucity of quality standards. The uptake of innovative technologies and practices was slow. There was huge variation in the nature and quality of care being provided, so-called post.
yeah, so I basically they are helping us also in our process, and at this time we are taking their help in the next series of workshops. And this was in brief what I wanted to mention about IHOPE's work. But happy to take questions, and over to you, Dr. Ravindran. Thank you so much.